Welcome everyone to a brand new webinar with cosmetic laser dermatology. Today we are going to talk all about different high-tech solutions to clear up summer skin damage. And Dr. Monica Boen is going to lead the way. She's going to talk about everything from, lasers, clear and brilliant and Fraxel, but even to non-lasers and other treatments that are available. And this is something that's important for all of us. So as a reminder, we do have 8 board-certified dermatologists at CL Derm, and all of them are knowledgeable in these laser treatments. And then vice versa, Dr. Boen today, while she's speaking mainly about lasers, she also is an expert and does amazing work with injectables and fillers and body sculpting. So just know, she is a great option for any of your cosmetic dermatology needs. And speaking of Dr. Boen, if you are not familiar with her, she is an amazing board-certified dermatologist. We are so lucky to have her at CL Derm. For a while, she was also working at our sister practice, West Dermatology next door. Now she's full-time at CL Derm. But I bring that up because I just want to, make sure everyone knows these are board-certified dermatologists, and Dr. Boen is also, very confident in discussing any of those issues. And there are medical derm issues that people come to us at CL Derm for, like maybe acne or melasma. If it can't get your rosacea, it's not working for traditional treatments, you can come on over and see Dr. Boen, and we can help with some of the laser treatments potentially. So without further ado, I will hand the floor over to Dr. Boen. Thank you.
Hi, I'm Dr. Boen. Welcome to our Cosmetic Dermatology webinar series. Today, I'll be talking about high-tech solutions to clear up summer skin damage. So first, let's address what does healthy, flawless skin all have in common? So this is an example of Anne Hathaway, beautiful, flawless skin. Jennifer Gardner, beautiful, healthy skin without makeup. Michelle Yeoh, beautiful skin. These are actresses in their 40s, 50s, 60s. Their skin is glowy and dewy. So what do they all have in common? So these celebrities have minimal to no age spots. They have minimal hyperpigmentation. They have an even tone. They have a smooth texture. And healthy skin does not have extensive sun damage, as you see on other celebrities, where they don't have the hypo and hyperpigmentation from excessive sun. And so I think the first thing we have to address is how the sun ages your skin. And I'm practicing in San Diego. We're exposed to sun all year long. And so ultraviolet damage is one of the causes of skin aging, along with other things, intrinsic aging, pollution, and other environmental factors. And there are two main sources when we talk about UV radiation and damage of the skin. The first one is UVA. So UVA goes deeper into the dermis, as seen here in this diagram, and it causes wrinkles, premature damage, DNA damage, and it damages DNA via free radical formation. And I want you to remember this phrase, free radical formation, because I'll be discussing that later in the presentation and how to prevent that. UVB damages the top layer of the skin, as seen in this diagram. This is the wavelength that is responsible for sunburns, blistering, and skin cancers, such as basal cell and squamous cell carcinoma. And it does this by actually direct DNA damage. It causes these cyclobutene pyrimidine dimers that actually damage your DNA. And luckily, the DNA has ways to repair itself, but over time, our body gets less adept at doing this DNA repair. And this is how we form skin cancers and other issues. And just to remind everyone, 1 in 5 Americans will develop a skin cancer in their lifetimes. This is why prevention is so key. And we'll also be talking about how lasers may help prevent some skin cancer development, which is very exciting. So these are some examples of sun damage. These are precancerous lesions, actinic keratoses from severe sun damage. And I'm sure many of you have seen this photo from the New England Journal of Medicine. This is a truck driver who had extensive damage on the left side, and on the left side because of driving. He was exposed to sun from the left side. You can see how that sun prematurely ages the skin. So how do you protect your skin from UV radiation? First, I am a big proponent, and I'm always wearing this, UPF 50 clothing or thicker, darker fabrics, seeking shade or avoiding sun during peak hours, and SPF 30 or above. Actually, the higher the SPF, the better the protection. It is not a linear relationship, but studies have shown that SPF 100 compared to 50, if you're out on the beach all day, the 100 will give you more protection. But as long as you're wearing a sunscreen over 30, you should have good protection if you apply every 2 hours. As you can see, my kids are always in hats, some of clothing, sunscreen, and I'm using this beach towel as a darker fabric to protect my legs. So let's get to now how we use lasers in our clinics to help reverse sun damage. So this is an example of a beautiful patient who had melasma and sun damage. Melasma is a condition that causes irregular hyperpigmented patches on the face, predominantly in women due to sun exposure and hormonal changes in others. And usually melasma patients also have photo damage, so we have to treat both. And I will go over some of the regimens, skincare, and lasers to achieve this result after a series of treatments. And as you can see, after the laser treatments, the skin looks glowing, it looks healthy. And this is my goal for patients, to have even skin tone, healthy glowing skin, and so that you don't have to wear makeup if you choose not to. So let's start with skincare. So these are some of my favorite products. So first, and we all carry these at Cosmetic Laser Dermatology. So some of my favorite sunscreens are the Isden sunscreen. It is an SPF 50, 11% zinc. It's mineral based. And it also has enzymes from plankton that help with DNA repair, and also vitamin E. I love the Elta MD sunscreen, cosmetically elegant, and then the Elastin Hydro Tint. These sunscreens are also available in tinted, which offers better protection for visible light, especially for my melasma patients. And vitamin C is also crucial to use in the morning. So remember when I mentioned that UVA damages DNA via free radical formation? Well, vitamin C can decrease that free radical formation. And that's why I suggest patients use this in the morning. And I like the SkinCeutical C Ferulic and the new Elastin C Radical Defense. And then these are some of the skin brighteners that I also employ to help get rid of background hyperpigmentation, the Isden Clear, Skin Medica Even and Correct, and Elastin Illuminate. These have active ingredients, tranexamic acid, and other plant botanicals that target the melanin production pathway, so they decrease the amount of hyperpigmentation in the skin. So first, let's address this common laser combination I use with the Fraxel Dual and pigment lasers, the Q-Switch Alex PicoWay PicoSure. This is a very unique combination that we use at Cosmetic Laser Dermatology. And I also do Botox and filler treatments on the same days as these lasers to save you a visit. It is safe to do these on the same day, and they can save you a visit as well. So let's talk about the first laser. So this is one of my favorite lasers. This is the Fraxel Dual. This is a non-ablative fractional laser, which means that a fraction of the skin is treated so that the untreated healthy skin is not treated, and you have a faster recovery than if you treat the entire skin. It causes these microscopic laser columns within the skin to help remodel collagen, hyperpigmentation, and photo damage. So I use this laser for hyperpigmentation, to reverse photo damage, for fine lines. This is an example of a patient getting treated. Is a rolling device. This patient, we always use topical numbing and a cooling fan to help with treatment. And the whole face is treated, and we're also treating her chest. So not only can we treat the face for photo damage, but also neck, chest, and hands, because these also get significant amount of sun exposure and sun damage. The downtime, this is one of our more aggressive treatments. It is a light 5 to 7 day downtime with some crusting, using bland emollients, gentle cleansers, and sunscreen. And what is exciting, new research has shown that non-ablative fractional lasers like the Fraxel Dual can actually prevent certain skin cancers. So this is a study that looked at patients over the course of 6 to 10 years, and they compared patients who've had this Fraxel Dual or a similar non-ablative laser treatment to those who had not. And patients who've had the laser had half the amount of skin cancers, particularly basal cell and squamous cell carcinoma, than patients who did not have the skin cancer. So that goes from a 40 to 20%, risk reduction. And that is significant. And also the patients who have the laser treatment, the time for them to get the skin cancer, which much later on than patients who did not. So this is exciting to know that perhaps doing all these laser treatments and making the skin healthier is also doing something to prevent skin cancer, to prevent damaged cells. And so now let's go to our pigment laser. So we have all of the pigment lasers, the wavelengths that needed to clear certain pigments. And not all clinics have all of these pigment lasers. We have the Q-switch Alexandrite, the PicoWay, PicoSure. These can be used on almost every skin type, and they really are the best for like sunspots, freckles. We use them for certain birthmarks too. These are cutting edge lasers for hyperpigmentation. They're ultra fast, high powered. And I'll show you some examples. This first one here is the PicoSure laser. We're doing an all over treatment, just topical numbing. You have some crusting for 3 to 5 days after. And then this is the Q-switch Alexandrite. You can see afterwards, this one that you have like a nice white crest to the lesion. That means it's been fully treated. And then those darken, they crust up. And then in the healing process over a week or two, they will crust off and that spot will be, sunspot will be much reduced. And once again, at Cosmetic Laser Dermatology, we have these unique lasers to use on the same day that Fraxel Dual and these pigment lasers to really clear this photo damage for you. And these are some examples of using this combination of the Fraxel Dual with our pigment lasers to clear some photo damage. This is after one treatment. You can see a lot of the sunspots are gone, but we'll still do another treatment to fully clear more of the pigment. And this is also that combination. As you can see, the skin just looks a little brighter after this combo, more clear, the sunspots are gone, a little fine line improvement too. And after a while too, they come to me because it's hard to cover this with makeup. And so after we clear all this hyperpigmentation and brown spots, they really don't need to wear makeup as much. So now we're going to shift to the clear and brilliant laser. I call this like the baby Fraxel. This is a lower downtime laser. For this laser, you can go to work the next day. And so in patients who don't want the more aggressive treatment, the Fraxel Dual, we'll do the clear and brilliant. This also creates microscopic treatment zones to replace damaged skin and stimulate collagen and treat hyperpigmentation. I also combine this laser with Q-switch Alex PicoWay PicoSure to improve sunspots and pigmentation. Once again, I believe this combining these lasers is what makes our clinic truly unique and allows us to clear this hyperpigmentation for an even skin tone. And this is just mild topical numbing and minimal downtime once again. And this is the laser I really like to use for melasma. And so this is actually over a series of treatments and with a topical medical grade skincare regimen, we're able to clear a lot of this. And melasma is very hard to treat. We have to use these cutting edge lasers. We have to try new things. And luckily we have, over 50 lasers that we can use to help clear this pigment. So these are hard conditions to treat. And we can treat these on most skin types as well. And this patient came because she could not hide these brown spots anymore. And it was really causing, a negative impact. And she didn't know at her age that you can even do these lasers. She did not want a lot of downtime. She wanted to go to work the next day. And so we used the Clear and Brilliant and then the PicoWay laser to help clear these sunspots. And after a series of treatments, she looks more rejuvenated. She looks youthful. The skin looks glowing with by treating these sunspots in a very non-invasive manner. Because my older patients, they don't want a lot of downtime. So I want to play pickleball, a few days later. And so we do have like these newer lasers that can give you less downtime so that you can go back to work and go back to your normal activities with good sun protection and skincare, of course. And sometimes you get hyperpigmentation from acne. This is very common. You get redness, hyperpigmentation, and patients, this lasts for months and months for patients. They don't know that you can actually clear this with laser faster. And so this patient had hyperpigmentation or redness from acne for months and months. And we did a series of, we also did a V-beam for redness and a clear and brilliant laser, and this helps clear her pigmentation. And I also put her, on a good skincare regimen to make sure that pigmentation doesn't recur. And this is what we're able to do with these lasers to really kind of clear up the skin and, give patients more confidence to do their daily activities. And we also treat, these keratoses and sunspots. So keratoses are benign growths on the skin, but as you can see, they can give an aged appearance. And so I did a combination of lasers, the PicoWay, and other devices to help clear. This is actually after one treatment to help clear all of these keratoses. And once again, the skin looks brighter, more youthful, and healthy after clearing some of this sun damage. And so I did a lot of photos for sun damage on the face, but we also do a lot of treatments for the body. And so one of the lasers, energy-based devices I'll highlight for the body is intense pulse light. This is also known as a photofacial. It uses high-intensity pulses of visible light to improve the skin by targeting redness and hyperpigmentation, and it stimulates collagen. And this is also a very low downtime laser. You can do with or without topical numbing. It's relatively quick, and I do also pair with our pigment lasers as well to do this treatment. And here we're doing face, neck. A lot of times we do face, neck, and chest same day to help restore and rejuvenate those areas on the same time. These are example of treatments of the hand. So the hand is actually a common complaint I get because we see our hands every day. They have so much sun exposure, and we're able to clear these brown spots relatively well within a few treatments. This patient had extensive photo damage and also bruising and hemosiderin deposition, and we're able to clear not all. For severe cases, we can't clear sometimes all the photo damage. We can make it much improved so that this patient didn't even want to wear like short sleeves because of this hyperpigmentation. And by clearing it, she can wear short sleeves again. And this really makes a huge impact in patients' lives. And in San Diego, the chest also has so much sun damage from just exposure every day. And so this is after one treatment of IPL. After the second one, we'll get more clearance. So this is a common treatment I use for the chest. I also do Fraxel Dual or Clear and Brilliant or other lasers too, depending on the severity of sun damage. And also, I talk to the patient, make sure we have, downtime for these procedures. And so each of these procedures are tailored to the patient, their downtime, and what type of photo damage they have. And this is another example of photo damage on the chest that we can clear with these laser treatments. So in summary, at cosmetic laser dermatology, we use these unique combinations of high-tech lasers to treat sunspots, hyperpigmentation, and general photo damage and fine lines. And once again, we can also do, aesthetic injectables, neuromodulators, such as Botox or Dysport on the same day. And then depending on the patient needs, we can tailor this to a more aggressive treatment or a less aggressive treatment needing more treatment sessions. And, finally, treating sun damage not only can create glowing, even skin, but new research has shown that it may also prevent certain skin cancers. And this is exciting because we're not only, I think, by creating this healthy skin, we're not only giving, patients a nice aesthetic appearance, but we're also preventing skin cancer, which can be very impactful for patients. So thank you for joining our webinar series. And please follow me at Dr. Monica Boen for more information. These are my fabulous MAs, Vera and Veronica. If you've been at the clinic, you've probably seen them. And I will open it up for questions.
Great. Thank you so much, Dr. Bowen. I am just going to pop in her Instagram link here in the chat so that you guys can easily click on it. Here we go. But anyways, it is time for open question and answer. So there's already a couple in here. We'll get into it, but everyone else, this is your time. Go to the chat feature here and pop in any questions. All right. And then if you don't mind, I'll remove your screen so everyone can see you a little bit better. All right. So here we go. How many treatments does it take to remove brown spots, and how far apart should the treatments be done?
Yes, so for the brown spots, it'll really depend on your skin type and severity of the brown spots. And so it can take between 2 to 4 treatments to remove the brown spot. And of course, I will evaluate the brown spot and make sure it's something we have to biopsy before, because we are medical dermatologists as well. And so it'll really depend on the type, but it's usually between 2 to 4, 2 to 5, about a month apart.
Really helpful. And yeah, actually, you brought up an interesting point. So people come in and they think they just have some sun damage or some brown spots. What else could it be? Why is it worthwhile to see a dermatologist?
Yeah, I mean, it could be melasma, it could be a birthmark, it could be a mole that is, it could be a melanoma. That is the most severe thing. Some patients have walked in, they want me to laser something, and I tell them, I'm suspicious for a skin cancer, and ends up being melanoma. So this is not something you should, you definitely want to make sure you see some board certified dermatologist who's certified in detecting these types of skin cancers, because the last thing you want to do is laser a melanoma. That's something that needs to be treated surgically and managed.
That's really helpful. All right. If my primary concern is skin tightening, would Clear and Brilliant be a good option, or should I consider other treatments like microneedling with RF or ultrasound or collagen stimulators? I'm a 30-year-old female.
Yes, so for skin tightening, we have a little different options. Clean Brilliant is more for like skin tone, texture. But for skin tightening, we have all the skin tightening devices on the market. Ulthera, Softwave, Thermage, and Potenza, which is radiofrequency microneedling. And then also, if it's a volume issue, we have biostimulator fillers such as Sculptra. And then, so those are like our little different lasers that we use specifically to target skin tightening.
And if someone has skin tightening and brown spots, is that kind of thing you could combine and treat at the
Yes,
same time?
we do very frequently. We'll combine Ulthera or Clear and Brilliant or PicoWay Ulthera same day to target skin tightening and also the hyperpigmentation and brown spots.
Yes, I love that. That's what I need. All right. Let's see, are the treatments permanent if the patient remains vigilant about using sunscreen, or will melasma eventually reappear?
Yes, that's a great question. So a lot of these melasma, and unfortunately, like some severe sun damage can reappear because we're still in the sun every day. We're still getting exposed to free radical formation and DNA damage from the sun. And so patients are coming in for maintenance treatments. If it's not too bad, I see them twice a year. Sometimes for melasma patients, I see them 3 times a year. And we're kind of playing around with skin brighteners in between to make sure that the melasma is quiescent and stays under control.
Yeah. Can you clarify which, if any of the lasers have any evidence for skin cancer prevention?
Yes, yes. Let's go back to that slide. So go back to, and so these are some of the examples
But
of,
you need to share your screen again.
oh, okay.
Sorry, I took it down. Okay, perfect.
Okay. And so this is the patient who had like the Fraxel Restore Dual with the pigment lasers. And so we'll talk a little bit about so the Fraxel Dual are non-ablative fractional lasers. These are this is the laser that actually has been shown to treat precancerous lesions. So that's a great treatment for that. But this is also the latest research shows it could prevent skin cancer. So this is great. This is out of Boston, out of the Harvard MGH physicians, and it's something that we've kind of seen anecdotally in clinic. These patients like, oh, they don't have as much skin cancer, and so this is a formal study showing that. And we also have another great treatment at cosmetic laser dermatology called photodynamic therapy, which we combine with several lasers. So this is already a treatment for precancerous lesions, but we actually give a more aggressive treatment of photodynamic therapy, combining with lasers to not only also have some skin cancer prevention, but to treat precancerous lesions as well.
Yeah, I love that. We have a whole nother webinar on that. If someone's interested, chat me here. I can pop it over. All right. Do any of these lasers minimize any facial scarring that I have due to stitches?
Yes, so we do, I use the Fraxel Restore laser and the V-beam very frequently, and I like to see patients actually 3 to 4 weeks after their surgery. The earlier you treat a scar, the better with lasers. And a lot of times, I see online that they say wait a year to treat your scar, and that is completely false. The multiple studies showing that the earlier you treat a scar with lasers or other modalities, the better outcomes you will have.
Got it. All right. I have dermatofibroma on the leg that bothers me aesthetically. Some dermatologists have recommended against removal because it would be a worse scar with excision. Are there any instances where a laser could be an appropriate treatment?
No, that unfortunately we do not have. I know we do not have a solution for the dermatofibromas, unfortunately.
Okay. Um, I was wondering if you treat sun damage under the eyes. I've had several sessions of treatments at med spas, and since they use the eye protection stickers, I feel like I have a demarcation line of sun damage along the tops of my cheeks and under eye area.
Yes, so we can treat up to the lash line. We use special metal contacts. So treating by the eye is very dangerous. So we use every precaution. And I do this in our Take 10 procedure, particularly. So our Take 10 is our laser resurfacing procedure, amazing dramatic changes in skin texture, tone, a little more downtime, of course, but we actually use metal contacts in the eye, and we can laser right under the eye and actually on the eyelid as well safely. And so for that, if patients are concerned with foot damage on the eye, we will put a metal contact in, and then we can safely treat around that area for you.
Yes, and that is a great point of differentiation between going to a med spa and someplace like a board certified dermatologist, because since we have the facilities, we actually have a fully, accredited operating room if we need to, yeah, like Dr. Bowen said, I've watched them. They get right up here, you guys, and even on this lid, they clear and brilliant into my own lid last time. It was so cool. All right. Let's see. Is there a different treatment or intensity of lasers for someone with ethnic skin types if they're concerned about hyperpigmentation?
Yes. So on more melanated skin, you have a higher chance of post-inflammatory hyperpigmentation. So you have to be more careful with the lasers you choose. So I have this whole kind of like pre-treatment regimen for more melanated skin, and also I use different lasers. So maybe I won't use a Fraxel Dual. Maybe I'll use a lighter laser and lighter settings in order to treat the hyperpigmentation in a safe manner, because there's also a myth that you can't laser skin of color, but you can. You just have to choose the right laser and be really familiar with these devices and how to do the aftercare.
Um, Got it. All right. Perfect. So here's another question. Thank you for your time tonight. I was wondering if you have any recommendations for lower level sun exposure, both to get vitamin D, but also is there a way to still get tanned while minimizing sun damage, i.e. a longer time at a lower sun index, or is tanning always associated with sun damage?
Yeah, so luckily the vitamin D, even with sunscreen, it's not perfect. You'll probably, if you're like out for half an hour with sunscreen, you'll probably still get enough vitamin D, but also I do encourage supplementation. But I know this is a tricky subject, but supplementation too is another way to make sure you have enough vitamin D, which is important for bone health. Unfortunately, like any tan, it is basically damaged skin. So that is the problem with the tan. Like a tan skin means already been damaged. There's already like UV damage done. So there may not be a safe line. And as a dermatologist, it's hard to like recommend that too. Like what is a safe sun exposure?
All right. Would you be comfortable talking about the BBL kind of Hero and Moxie lasers and how they compare to the procedures and lasers you mentioned?
Yes, yes. So the BBL, we do not have those lasers, but instead we have the intense pulse light and clear and brilliant. And so these are actually the intense pulse light has been around longer than the BBL. They're a little different mechanisms of action. And then the Moxie is a little similar to the clear and brilliant. And so there are some similarities, but once again, even though like it's kind of sometimes more the familiarity of that the physician or provider has with the devices is probably, even though the devices are very important, you have to be like really familiar with these devices. And these devices, like all the other ones we've mentioned, we've had at least, maybe like 8, 10 years. So this is like we've grown very familiar with these devices and how to use them safely on different skin types. And so we have tons of experience combining these. And I think the devices matter a lot, but I think also it's the experience of the operator that matters for these devices.
Absolutely. And that's why, we have over 60 devices under our roof at CL Derm. So, we can rest assured find the right one for you. All right. This gentleman says, I have major sun damage. I'm 60 years old and grew up here in La Jolla. What do you suggest?
I mean, if we have extensive sun damage, I might recommend the Take 10, even though that is a lower, a more downtime procedure. The Take 10 is one of my favorite procedures too. That is a laser resurfacing. We are basically, getting rid of that top layer of the sun damaged skin and growing new skin. And with that top layer, all the browns come off, and that is truly a rejuvenative procedure. So
Yeah.
that's usually, and that's usually the patients I treat too. Around that demographic is like, we want to do a bigger procedure and it gives you like longevity, the skin looks healthier. And these are the type of patients who I think really love the Take 10 procedure.
Got it. And so if you have a patient that comes in that has a lot of sun damage, but they don't want downtime, you would have an option. And then, or if they say just do it all at once and get it all done.
Exactly. We can tailor it. If patients don't have that downtime, we will use like, like lesser lasers, maybe more sessions to get that result as well.
It. And someone asked to clarify, is the IPL the intense laser? So maybe you can just clarify what IPL stands
Oh,
for,
yes.
what it
So the
is.
IPL is, it's called intense pulse light laser, but it is more of our minimal downtime lasers. This is actually a high intensity visible light, so not a laser per se. And so this treats reds and browns, but lower downtime. This is one of our like more lunchtime lasers. That and the clear and brilliant and our IPL intense pulse light are more of our like lunchtime lasers and lasers we use also like for maintenance for when after we do these more intense like Fraxel Dual procedures to maintain your results and keep that photo damage at bay.
Makes sense. Okay, guys, I think two more questions here. So if you have any, this is your time. Can facial granuloma annulare, I hope I said that right, be treated with a laser?
Yes, so there has been a recent report by our colleagues in the Mayo Clinic that a Fraxel Restore may be able to treat granuloma annulare. So those are something we can treat, and then also with like medical management. But that is probably one of the latest updates for that condition.
Cool. I almost said it right.
Mhm.
All right. So how often should someone have, an IPL or a clear and brilliant in a perfect world?
In a perfect world, it really depends. Usually if there's not as much photo damage, then, 2 times a year, 2 or 3 times a year, just for maintenance. Younger patients, I say, once or twice a year. Older patients, maybe I'll see you maybe 3 times a year, just because unfortunately, as we grow older, we were kind of like stimulating our cells to, we want to help them regenerate and to generate new collagen. And so they need a little bit more help as we gradually age, unfortunately. And so, and that's why a patient actually came by and said, how are all these like 50 and 60-year-olds looking so good in your waiting room? And it's because we have this technology, we have these maintenance treatments to help these patients look their best by helping them regenerate collagen in their own cells so that, even though they're, 50, 60, they still feel young. They look young too.
Yeah, absolutely. And then how about combining IPL and Clear and Brilliant?
Yes, so another, this is our very unique combination at Cosmetic Laser Dermatology is our photo fractional. So we do IPL, Clear and Brilliant same day. These are minimal downtime lasers. So you get the benefits of both technologies on the same day and still very minimal downtime. And so that is a great option for also maintenance treatments twice a year. Patients come in for this and like their Botox. And this is a great just maintenance therapy just to slow the aging process.
Got it. Why does sometimes that loss of pigment or white skin happen with lasers?
Yes, so that is always with each of these lasers, always a risk of, infection, pigmentation, and sometimes I guess you can, depending on how the users, I guess that's also always like a possible side effect.
Got it. Do you recommend melasma patients avoid red light therapy?
I do for the melasma patients because visible light has been shown to increase hyperpigmentation.
Thank you for clearing up that myth. Here's a great question. All these treatments you're talking about, can they be done on the neck too?
Yes, so I love patients always forget about the neck, but the neck ages so much faster. So, the first we do the face, but then we move on to the neck because the neck really does show age, and then the chest. And so a lot of these treatments too, we're doing on the neck as well.
Yes. And I don't know, this might sound crazy, but my sister lives in Hawaii. She just flew here and went in and got a treatment and she did her legs. So you can also treat
Yes,
those.
I mean we do like full body with you, arms, legs. Yeah,
Yeah.
this is anywhere, the sun damage can be anywhere.
Yeah. I know people a lot of time think of us as only face, but we do lasers all over the body.
Yes, yes.
All right. I think last question, unless someone else pops one in. What
Sure.
is the difference between IPL and Clear and Brilliant?
So IPL is more of like it's basically like high intensity light. And so it treats reds and browns, while Clear and Brilliant I use more for hyperpigmentation and like texture tone of the skin. And so you get a little bit like more peeling with the Clear and Brilliant, a little bit more texture improvement. In the IPL, you get more improvement sometimes with like redness and pigment together. But they're still like low downtime lasers. They're still good options. And that combination does work beautifully as well.
And since tanning is not recommended, are there any dermatologist recommended self tanners or skin tints if you want a little glow?
I mean, I really like the tinted sunscreens. I'm very pale, so I have to combine usually with another sunscreen, but tinted sunscreens are great. Yeah. And I know patients, I don't do spray tans, but I'm embracing my paleness, but um
Yes, paleness is the new beauty. All right, well, I'll pop in here a link so you can see our skincare on our website, and there are a
and
number of them with tints in them.
yeah,
And I agree. Sometimes I use those. It's almost like as if you were to use a foundation, like a
yeah,
little
yeah.
extra coverage.
And then I have our little goodie bag. So we have three winners. Oh, let me see. We have three winners today. And so this is the
Yes.
goodie bag you're getting, an Instant Clear, and then an HA/BHA exfoliating cleanser. So it's a cute little gift bag. And we will, and Risa, you can tell them a little bit about how they might win.
Yes. So, yes, three of you lucky attendees that came today are going to win that basket that Dr. Bowen just held up and 10% towards a laser treatment for pigmentation with Dr. Bowen. So, we're really excited. I have officially now captured everyone on this list that's still here, and we will choose three winners at random and notify you all tomorrow. I don't want to disrupt anyone's privacy by saying their names publicly right now. But so thank you so much for coming. And In general, I know that, it's like, is it summer over? I mean, it's still kind of beautiful here in San Diego, but I think this is a really good time. We're getting booked up and this is our busy season. So I think booking now with Dr. Bowen or any of our providers at Cosmetic Laser Dermatology to make sure that you can clear up all that summer sun damage before we get into the holiday season is a really good idea, because everyone always wants to come rush in at the end. And then a lot of times we're booked out. So I highly recommend getting in your desired date and time now and, joining us. And hopefully we all can have skin that looks like Dr. Bowen's, like porcelain. And we can turn this into the new beauty. The new beauty is like this pale, gorgeous skin. And
I've
oh,
tried
thank
all the
you.
lasers personally, so
Some people are
multiple
saying thank you.
times.
Great questions. I learned a lot. So yes, thank you, Dr. Bowen, so much for spending your time. I know you had a busy day seeing patients and now you're home with your cute kiddos. And thank you for taking the time to answer all these questions and educate us all.
Thank you. And thank you everyone for joining the webinar. I appreciate taking your time and hopefully this educational content can help improve your decision and how to treat your photo damage. And thank you again for coming to the webinar.
Yes, thank you so much. Thank you, Jessica. We look forward to seeing you soon. All right, everyone, stay tuned for the recording this weekend and make sure to follow Dr. Bowen on Instagram. Okay, bye.